Hi all, in this video I will tell about what is Dr. ABC in prioritization. Uh, Most of the NCLEX RN questions are priority based questions. So how we can identify what is the most concerning need or what is the most priority intervention of the client. Okay, so we can previously it was ABC. Now when D and R is also introduced, and now it is known as Dr. ABC. So D indicating that we need to find out whether the patient is undergoing through any hazardous scene. Okay, that means, for example, if the before checking the airway, we need to understand or we need to realize any signs of danger. For example, airway obstruction can be occur if there is electric shock has occurred, if there is any burn, okay, and if the client has any ingested any poison, any toxic material, okay, in such cases we need to understand the danger sign because we need to ensure the safety of the healthcare workers also. So in order to maintain the safety of the client as well as the healthcare worker, we need to ensure the danger sign. Okay, first we need to make sure whether the situation is safe. Okay, yeah, and if there is a situation that if we want to wear the personal protective equipments like a gown, mask, we need to wear it. Okay, without gloves or mask we should not approach because it's unsafe for the healthcare worker. So danger sign is the first one. Second one, we can check the response of the client. That means we can check the consciousness of the patient. We can call by or we can shake the patient and we can shout. Okay, we can ask the patient, are you okay? Okay, that means we can shake the shoulders and we can, if, by checking the response, we can check the what alertness of the client, we can check the verbal response of the client, and whether the patient is responding to pain or the patient is unresponsive. That means from this we can understand whether what is the emergency situation, whether the client need an emergency intubation or the client need an rescue breathing, the client need an CPR, whatever it is, we can understood by checking the response. Okay, A means airway. Airway, we know that we need to use the method head tilt method or chin lift method because to rule out any airway obstruction. For example, in case of foreign body obstruction, okay, in case of tongue falling, in case of aspirate secretions, there is a risk for aspiration. So we need to ensure the airway and it should be intact and it should be open and clear. Okay, so if there is a lot of secretion and if the client need suction, we need to do the suction in an emergency situation. Next one, breathing. Breathing, we can assess for the breathing pattern. We can check the respiratory rate of the client as well as we can check the oxygen saturation. Okay, we need to find out the saturation level because to find out whether the client is going through in a situation of hypoxia or not. We know the normal oxygen saturation is 95 to 100 percentage except in COPD. In COPD there is 88 to 92 percentage. If the client is having less than 90 percentage oxygen saturation, client need an emergency into what oxygen administration. Like that we can check the breathing pattern. In addition, we can using the stethoscope we can auscultate and we can check the bilateral air entry and we can check for any abnormal breath sounds like crackles, wheezing, wrong gaze, strider if it is indicating that there is airway and breathing compromise. Last one, circulation. Circulation mainly we can focus for in case of bleeding, in case of burn, okay. And how we can assess the bleeding, we can checking the pulse, okay. And also then we can check the skin color. If there is any bluish discoloration, that indicating that hypoxia. We can check the BP and heart rate. If the client is having low BP or hypertension or tachycardia, that man indicating sign of the decreased cardiac output. Also, we can assess for the bleeding. In case of heavy bleeding or in case of massive bleeding, the circulation will be our highest priority. In the ABC, according to the problem, we can convert it into ABC or BAC or CAB. Okay, so our NCLEX priority is mainly we in the assessment order, Dr. ABC. First, we need to look for the danger sign. Then we can check the response of the client. We can assess the airway for any airway obstruction. We can check the breathing for the breathing pattern as well as for the oxygenation status. See for the circulation for to understood about the hydration status of the patient, and also the if there is any control with the patient is having bleeding, it need to be controlled. So hope you got a understood about the doctor ABC. So each one, if the client, the how we can manage the danger sign like any fire or any electricity or any other danger sign like radiation like that. Okay, and in by assessing the response, we can shake the shoulder and we can ask the patient whether he is okay, and we can give time to respond with the client. Okay, then we can check the airway by using the method head tilt and chin lift method. Okay, and one more method is jaw thrust method. Okay, so then interventions, in case of breathing compromise, we can check the oxygen saturation, and if it is less than 90, the client need oxygen therapy. In some cases, the client need an bag and mask ventilation in case of inadequate breathing. Okay, so if the patient is having bleeding, we need to control the bleeding. Direct pressure can apply first, and to prevent the shock, we can administer IV fluid as a rapid replacement of the fluid, and if there is no pulse, we can immediately start the CPR. So this is the memory trick that danger rules all before ABC. So key actions are we need to ensure the safety, we need to understand the response, understand the airway breathing, and we can quickly action and manage immediately. Okay, so hope you got a idea about the Dr. ABC. Thank you.